The Omicron variant of COVID-19 comes to Canada, so let the fear-mongering begin. I'm Candice Malcolm, and this is The Candice Malcolm Show. Everyone, thank you so much for tuning in today. I'm going to stop you right now. If you're watching on YouTube, I'm going to ask that you like this video, that you subscribe to True North, and if you like what we do, if you like The Candice Malcolm Show, don't forget to hit that little notification bell so you never miss an episode. If you're watching on Facebook, please like True North, leave us a comment, and share this video with your friends and family. Finally, if you're listening to this podcast over on Apple Podcast, Google Podcast, or wherever you get your podcast, please don't forget to subscribe to The Candice Malcolm Show. And if you like the show, don't forget to leave us a 5-star review. It really helps us out. Okay, so the big news all over the world, frankly, and all over Canada is this new COVID variant, new strain called the Omicron variant, which is causing chaos. It's wreaking havoc. It's leading to border closures. There's a huge reaction to the Omicron variant. And so today on the show, we are going to go through that reaction and break down what we know so far about this variant. So the Omicron variant has been detected in Canada. It is here. It is in Canada. There have been 4 confirmed cases of this variant in Ottawa. Others are still under investigation in Ontario. This according to Global News. Ontario health officials have confirmed multiple cases of the Omicron COVID-19 variant of concern that has set off a new set of travel restrictions around the world, mostly barring flights from southern African nations. Ontario first confirmed Sunday that 2 cases of the Omicron variant were detected in Ottawa in recent travelers from Nigeria. Quebec, likewise, public health officials over there have confirmed its first case of the Omicron variant, also from recent travelers. And now, of course, because this is what happens. We've seen this movie before. We've lived this before. We're stuck in Groundhog Day over here. Ontario is now reviewing a 3rd dose vaccine strategy in the wake of this new Omicron variant, says the top doctor in Ontario. Will be reviewing options and providing them to government in the next few days. And I would anticipate an announcement by the end of the week on an enhanced strategy to best protect Ontarians, said Dr. Kieran Moore, the top doctor in the province of Ontario. So Canada has moved quickly this time around and put a travel ban on flights from South Africa and neighboring countries. This report comes to us from Post Media. It says Canada is closing the border to all foreigners who have been to 7 countries in southern Africa in the last 14 days as a new terrifying COVID-19 variant of concern raises alarm around the world. Okay, I inserted the word terrifying. That wasn't in the copy, but really, we are really reacting. We are really reacting to this new variant. So this is from Global News. Omicron variant prompts emergency G7 health meeting, including Canada. So the health ministers of the richest and most powerful 7 countries in the world have already gotten together to scheme and to talk and to try to figure out what to do about this Omicron variant. So Health Minister Jean-Yves Duclos and his counterparts from the other G7 countries agreed Monday to closely monitor and share information about the highly mutated Omicron variant of COVID-19. And it's not just the federal health experts that are sounding the alarm bell. Ontario Premier Doug Ford calls the new COVID-19 variant concerning as Canada implements a travel ban. So anyone arriving before the ban is implemented should be tested and quarantined, including the many passengers arriving today, said Doug Ford. Out of an abundance of caution, we must also reintroduce point of arrival testing for all passengers arriving to Canada, regardless of where they're coming from. And Aaron O'Toole has jumped on the bandwagon as well. This is what he posted on Twitter. The Liberals failed to shut down the border from high-risk countries at the beginning of the pandemic. Canadians can't afford Trudeau to make the same mistake again. That would be a good point, and I agree that Trudeau waited far too long to close the border from China. And as we all recall, we were told that closing the borders back in 2020 was racist. That anyone calling for a border ban or quarantine from China was just a horrible racist person. We heard that from the health minister. We heard that from the top doctor in Canada, Theresa Tam. We heard it from the prime minister. This time around, though, they've had a change of tune. So here, Alberta is also implementing new measures to track the Omicron variant, but no cases currently identified. So it doesn't matter that they haven't had any cases yet. Alberta is still reacting. So contact tracing and notification, PCR testing for all close contacts, and rapid testing for households, Specific settings such as schools and childcare facilities are being implemented by the province for all COVID-19 cases identified in returning international travelers in order to track potential cases of the new Omicron variant. Okay, so all of this is very concerning. Everybody is very concerned about this highly mutated variant. And what about our vaccine status? What about vaccinations? I myself have been vaccinated. I've had two of the jabs from Moderna. So let's see what Moderna has to say about whether I will be protected from this new variant. According to our friends over at WION News, which is an Indian news source out of New Delhi, they report that Moderna says that current vaccines are not effective against the Omicron variant. So the Omicron variant of the coronavirus, according to Moderna's senior medical officer, may evade existing vaccinations. If this is confirmed, Paul Burton suggested to the BBC's The Andrew Marr Show on Sunday that a reformulated vaccine might be ready as early as 2022. We should know about the ability of the current vaccine to provide protections in the next couple of weeks, but the remarkable thing about the mRNA vaccine Moderna platform is that we can move very fast. He said, okay, so bad news for me, I guess, the Omicron variant. I will not be protected against it with my current double dose of Moderna, but good news is on the way, says Moderna. Moderna says Omicron COVID-19 vaccine could be ready as early as 2022. This is according to Global. So the same fellow, Dr. Paul Burton, Moderna's chief medical officer, said in an interview that if a new vaccine is necessary, it's going to be ready soon, early 2022. It's going to be available in large quantities. So what a coincidence. They're going to have a new vaccine just in time for the Omicron variant. So I guess we're just doomed to constantly be forced to be vaccinated in order to keep up with the ever-moving goalposts of the COVID industry. So let's just pause for a moment before we all rush out to go get a new vaccine, before we rush out to go into lockdown again, to implement all these travel bans that we should have implemented in 2020. We didn't. Now this time around, we're not wasting any time. Every politician from every political party is jumping over themselves to try to close the borders, lock things down again. But let's just pause for a moment and try to research and try to learn a little bit about the Omicron variant and what we know about it. Because the reality is we just don't really know very much about the Omicron variant at this point. Very little is known. So this comes from the CBC, Canada's first cases of the Omicron coronavirus variant confirmed in Ottawa. It says this: little is known about the new variant, dubbed Omicron by the World Health Organization and labeled as a variant of concern. It is being linked to a rapid rise of cases in a South African province. It is not known at this time whether the variant is more transmissible or more dangerous to the health of those who are affected by it than the other coronavirus cases. So wait a second. So at this point, all we know is that there's a rapid rise in cases in the South African province. Okay, we don't really know much about that South African province. We don't know what the healthcare is like over there. And then it says this, that it is not known whether it's more transmissible. It's not known whether it's more dangerous to the health of those infected by it. So we don't even know at this point how dangerous or how transmissible it is. And yet we're all jumping over ourselves to try to protect ourselves against it. This is sort of the impact of what, almost 2 years of conditioning from governments, that there is nothing more important than our health, that there's nothing more important than our safety, that we should be willing to sacrifice everything for it, sacrifice our liberty, our freedom, our ability to go outside, sacrifice the education of our children, the development of our children, sacrifice jobs, sacrifice small businesses, sacrifice the future, our economic stability, the future of our currency, all to protect our health from this coronavirus. We're conditioned. So now anytime there's a new variant or news of a new variant or a potential new variant, we all dive over ourselves to try to protect ourselves. This is not a good sign. Even Dr. Kieran Moore, Ontario's Chief Public Health Officer, says that we really don't have the information yet about Omicron. Here is a clip of that.
As you realize, this is a rapidly changing environment. Lots of questions yet about this new strain that we have to have answers for. We need to understand really if this is a virulent infection, if it makes people significantly sick or leads them to hospitalization. We really don't have that information yet. So I could understand, in an abundance of caution, putting some measures in play like we've done already, and whether as we get more and more information, we put further public health measures in play. I can assure you we'll work with our federal partners to do that.
And that seems to be the consensus from news reports that I've seen. This is according to the Associated Press, what we know and don't know about the Omicron variant. By Sunday, the United Nations Health Agency issued a statement on Omicron that boiled down to this: we don't know much yet. It said it wasn't clear if infection with Omicron causes more severe disease, even as it cited data from South Africa showing rising rates of hospitalizations there. But that could be because people are getting infected with COVID, not specifically the Omicron variant. So according to Bloomberg, the Omicron variant is mild so far, experts say, but the WHO still urges caution. Symptoms linked to the Omicron coronavirus variant have been mild so far, according to COVID-19 advisor to the South African government and Pretoria doctor who first sounded the alarm bell of the new strain. The World Health Organization cautioned there's no information that symptoms caused by Omicron are different from other strains. Again, this all boils down to guesswork. We don't really know. Here is a report from CTV. Infectious diseases specialist at Toronto General Hospital, Dr. Isaac Burko, said it's too early to say how contagious the new variant is. You're going to hear a lot of scary things over the next day or two, but the truth is we just don't know about it. But we're going to learn a ton about this over the days and probably over the weeks to come, he told CP24 on Friday. And we have the WHO. The WHO says it's not clear if Omicron causes more severe disease. This is over on Reuters. The World Health Organization said on Sunday it is not clear if the new Omicron coronavirus variant is more transmissible compared to other variants or if it causes more severe disease. Preliminary data suggests there are increasing rates of hospitalization in South Africa, but this may be due to increasing overall numbers of people becoming infected rather than the result of specific infection with Omicron, it said. However, in a statement, the agency reiterated that preliminary evidence suggests there may be a higher risk of infection from the variant. Well, if Moderna is saying that the Moderna vaccine doesn't even protect against this variant, perhaps that is why we are of higher risk. But here's the thing. This is the problem with where we are as a society nearing the end of 2021, again, nearing the 2-year mark of the COVID pandemic and all of the corresponding lockdowns, fear-mongering, closures, paranoia that has been born out of this COVID virus, which is just as bad, if not worse, than the virus itself. That we now live in a society that is paranoid, a society that is willing to sacrifice liberty for the pursuit of safety, the pursuit of good health, and we allow politicians to just dictate to us that, okay, borders are closed now, forget about the fact that it's a Christmas holiday, that people might have trips planned, that people might have family members coming to visit. We're just going to completely overreact. That is the situation where we have been led. And let me just say, when I heard about this emergency G7 meeting of the health ministers of the richest 7 countries, my mind immediately went to this Ryan Long clip. Ryan Long is a brilliant sketch comedy writer and comedian. He's Canadian, but he's based out in New York, and he does these brilliant YouTube videos basically making fun of the left, making fun of the woke left. Most comedy these days doesn't do that. They're too afraid to go after the left. They only go after the right. Ryan Long is one of those fearless and brilliant comedians who is willing to make fun of the left. And he did a video, and I'm going to play it for you because, again, this is an American version. He's making fun of governors, but it could just as easily be Justin Trudeau and his health minister scheming on ways to lock us down again. So let's play this clip. It's about 2 minutes, but it is good.
3 governors once revered by the public.
Hey, we're governors. Show us some goddamn respect.
My book deal just got revoked. Everything's opening up. They're not even asking for permission anymore. They used to call me daddy.
Without this virus, we're nothing.
Where am I supposed to put these old people? Madison Square Garden?
Until one idea changed everything.
Hey, you guys ever think about getting the gang back together for one last lockdown?
That's crazy talk. It's over.
Yeah, unlimited snatch is a thing of the past.
Is it crazy? Canada's doing it.
But everyone's getting vaccinated. It's over.
Now we can do this.
You've gone loco, Newsom. It is over. You've been smoking too much of that legal weed.
Their critics said it couldn't be done.
It'll be like old times. You get on TV, scare them a bit, present ourselves as the saviors.
I like fear-mongering as much as the next governor, but it's over.
They haven't even taken off their masks. The water's still warm.
You don't think I love the daily press conferences? I love giving the daily press conferences, but it's over.
You know, Cuomo, I'm starting to wonder if you even want to be a god.
Screw you, Newsom!
You're out of order.
But it ain't over till the fat lady's on a ventilator.
Hey, Newsom, we're in.
Don't make me regret this.
One last lockdown.
Newsom, what about the science?
We'll tell them what the science is.
But what about the protest?
We'll tell them when to protest.
I found a scientist that'll give us the numbers we want.
So Fauci says we're at the bottom of the 6th inning. We need to convince them that it's game 1 of the series.
You know, my researchers tell me this new strain stuff really resonates. My DMs are lighting up again.
Oh, baby!
Cash is flowing in.
Who runs this country?
We do.
Who runs this country?
We do! I feel so alive.
This is what being a governor's about.
Gavin Newsom, Andrew Cuomo, and Ralph Northam. One last lockdown.
Stay at home is trending again.
Coming this summer.
It's too good, too funny. Go check him out, Ryan Long. His videos are on YouTube. Thanks so much for tuning in. I'm Candice Malcolm, and this is The Candice Malcolm Show.